Good morning, everyone. Welcome to the Higher Education Expo 2024 webinar session. With me today is Young Rachelle Garcia from JPMC College, who will be sharing a topic on breaking boundaries, expanding nursing horizon locally and globally. Without further ado, I invite you to start your presentation.
All right, good morning, everyone. Can you guys hear me? Okay, you can drop your thumbs up just in case you're hearing me. Thank you. And why am I here today? I would like you to think over about what nurse is all about and what is your perspective of a nurse. What comes into your mind when you see a nurse? Where do you usually see them? In many instances, you oftentimes see them in the hospital, right? And doing their bedside care. That is the traditional thought of a nurse. But nowadays, we see nurses anywhere around the globe, not only in Brunei, but everywhere else. According to our minister, Datu Isham, there is a great shortage for nurses. And this, in its essence, will bring about great demand for nurses, not only in Brunei, but globally. At present, we have only 71 is to 10,000 population of nurses around the globe. And it will definitely impact other programs for expansion and services. Hence, that world can be short of around 13 million nurses in 2023. Here's why. Because nurses are having more than hospital can offer. We are wearing varied hats. We are taking more opportunities and more roles in this arena. According to Indeed Career Guide, there are 31 types of nursing positions that awaits to nurses in the future with their duties and amazing salaries. And a good example is we can be a school nurse. Okay, school nurses earn around $54,000 in a year, which basically another opportunity for us. We can become home health nurse. And our duty is not very difficult because we can work at our own timeline. We can control and become mother while attending to our role as nurses outside the hospital. And mind you, we'll be earning more than 70,000 per annum. And we're talking about dollars here. You can also be a travel nurse. Imagine the luxury of traveling and enjoying your work as nurse. That's something else, right? And look at the figures. Okay, it's 6 digits. And it will not only give you that sense of satisfaction as you fly and travel around the world, but it will also give you that sense of satisfaction of um, meeting your career and your passion as well. You can also become nurse practitioner, another six-digit number that you may be able to help other physicians as they work their career and independently practice or outside the hospital. Another one is you can become a psychiatric nurse, another in demand nursing job for us. Mental health nowadays is on the rise, not only in Brunei, but it's a global perspective. And the demand for psychiatric nurse is very high as well. And look at the salary that awaits us. By the way, those salaries are not limited in Brunei, of course, they are the global figures. We can also become clinical nurse. Another area we're in, when you specialize, you'll be able to upgrade your skill and earn as much as 67 to $83 an hour. Take note, we're talking about an hour rate. And that is something that amazes us that we can earn and practice our passion. A clinical nurse specialist is an advanced practice registered nurse who can earn master's or doctorate degree and specialize on the following fields. Can be a pediatric nurse, a women's health nurse, geriatric nurse, psychiatric nurse, rehab nurse, wound care nurse, pain management nurse, oncological nurse, critical care nurse, and emergency room nurse. And there are a lot more specialization that you can master after your graduation degree. Another one is an aging population is growing, and it was delivered to us by our very own minister that in the long run, the world will be having 65 and above with about 761 million to 1.6 billion in 2050. And the demand for us to care for the elderly is a call not only in our locality, but also in the world. So everywhere you go, if you have mastered or specialize yourself as geriatric nurse, the demand is really very high. And for us to become wise career people, oriented people, we will be thinking ahead, right? We will be thinking of what uh, career, okay, will place us in the future. And not only place us, but will give us a good advantage, not only in terms of our marketability, but also with our pay. Another one is remote family nurse practitioner. Nowadays, families doesn't want to be confined in the hospital as much as possible. They want to enjoy their medical treatment at the comfort of their home. And obviously, remote family nurse practitioner will be another in-demand career in the future. And if you will specialize on this, you'll be earning about 88 to $172 a year. Quite a big sum, right? If you are into this disciplinary field and you want adventure, you can also become a military nurse. Imagine yourself with that adrenaline attending to emergency and that great adventure of traveling and attending to this wounded soldiers. You'll be able to get that kind of spirit, plus earn as much as about $75,000 an annum. So this is another career that awaits nurses. Another one is you can be a cruise nurse. Why not? Traveling through or by the sea is another exciting adventure that awaits nurses. And here on the slide actually is one of my former students who is now thankful that he ventured into becoming a cruise nurse. And he is navigating the world and meeting new people and enjoying the luxury of the cruise ship. So, you are not limited to being in the hospital. You have more opportunities that await if you are a nurse. Another one is if you are into technology. Nowadays, our current cohort are digital natives, right? They are more into the informatic sides or they're more into technology. So if you find yourself that your passion is into the nursing informatics or into technology, you still have a place to go that is aligned with your passion plus your career. So you can become a nursing informatics nurse and you can earn another enticing salary. And obviously, living your passion plus your career is something else. Another one is you can also be an educator. I am an educator myself, and I can testify. I'm a living testimony to this um, great opportunity that awaits nurses who ventured into the academy. And everyone else can become one in the future if you started as a nurse. So you can still have that passion to teach, plus you will have a good pay in the future. And obviously, you can climb up the career ladder. You can become a nurse manager in the future. As leaders, you will become part of the management team who can earn also and be and obtain that sense of self actualization by becoming part of the thinking tank of any organization, be it hospital or any healthcare institution. So there is leadership in you. You can become a nurse manager. Another one area that nurses nowadays can venture on is becoming a researcher. A highly specialized nurse who examine data, communicate with various stakeholders, and advanced level of education and experience, explore scientific experiments and other forms of evidences will bring you to a higher level of career, which is becoming a researcher. By the way, the one shown on board is another student of mine who joined the University of Queensland, okay, after graduating from Far Eastern University in Manila. He is now an epidemiologist, a researcher that mastered on mental health and adolescent health. So you see, you are not confined in the hospital. There are more areas that awaits, and you just have to find it in your heart where you fit in. And there are a lot of opportunities and doors that will bring about um, better career for nurses. This is another colleague of mine. He is now part of the World Health Organization. Who knows, one of these days you start in Brunei to become one of those members of the committees that formulate policies and guidelines. In the future, you can even navigate the world. And I believe our very own Datu Isha is now part of the World Health Organization, formulating policies for us. And nurses also can become part of those. And one of my friend is already in Geneva working as a nurse, health system specialist, okay, and in the World Health Organization. The becoming bedside care nurse seems quite lowly for some people, but I still believe that servanthood, though it may be demeaning and stressful and causing you burnout, you can find happiness where your passion is. Your nursing career is beyond the bedside, but I am opening up this opportunity for you to see that there are other avenues for us to explore once you obtain your career as a nurse. It is limitless. And I have gone into this article that says the 15 high paying jobs that will be in demand for the next years to come. Guess what it is? It is a nurse practitioner. So I believe you will invest to career that will bring you somewhere greener and happier. So for you to realize this career opportunity, it always starts with the first step, and that is obtaining your nursing career. And you can join us at JPMC College of Health Sciences and see us in Block 2C, Jalan Ong Sumping, Bandar Seri Begawan. And you may also contact us at 673-899-4954 and 673-866-1734. You can visit us or you can just check on our Instagram for more information. Thank you very much.
Thank you for your insightful presentation. Since we have no question from our viewers, we will conclude this session. Thank you, Yamulia, Rachel, Garcia, for participating in this webinar session. We hope this session has been beneficial for our viewers. Should you require further information, please feel free to reach out to us. Once again, thank you for joining us. We look forward to seeing you in our next webinar session starting at 11:50 a.m. Thank you. Goodbye.
All right, my pleasure. Thank you very much for the opportunity.